So in my video last week, we spoke about maternity nursing, which is pretty much the time period from the antenatal, labor and delivery, and postnatal. And with this whole setup, there's an important aspect that comes with that is we've given birth to a child, and this child is going to end up somewhere when they get sick. And that is what we're going to be speaking about today. Today we're going to be speaking about child nursing. And there's different aspects of the role of child nursing. So if you're someone who really loves kids and you want to work as a nurse, but specifically with kids, we're going to be talking about that. So depending on the age of the child and also the severity of the illness or the complication, etc., they'll end up in different places. So first off, we will have a newborn child born healthy, whether that was vaginal or that was via cesarean. And then they go home, and then sometime later they get sick. In most cases, they'll go via trauma and they'll end up in a pediatric ward. In most of these illnesses that you'll see is dehydration, gastro, some respiratory illnesses, whether that's RSV, rhinovirus, some flu symptoms, or you just have a child that's not eating or drinking well, or sometimes you have kids that have sleep apnea. So it's children that are sick but not severely sick. Then you might sometimes have children that either progress to severely sick or they come in severely sick, whether the child has croup or the child is having respiratory distress, or the child had a serious accident, drowning, falls, etc. And this child needs constant monitoring, and these children will end up in a pediatric ICU. Then sometimes you will have newborns that are preterm, and obviously because they cannot survive outside of the womb as of yet, and they need a lot of monitoring, and they just need a bit more assistance for them to be able to survive outside of the womb, then obviously they end up in the neonatal ICU. Then sometimes you will have babies that are born normally, but sometimes they're just, having a bit of difficulty just adjusting to being outside of the womb. Then you have some departments that will have a nursery where these babies will go, or sometimes moms that have given birth and they don't want to take the child home anymore and they want to give it up for adoption, and they will usually go in a nursery. So in a hospital setup, in most cases, hospitals will have either one of these 4 different setups, and children will go to these different wards or specialties depending on the severity of the illness. Then there's also another aspect of child nursing, which is school nursing, which is pretty much where a nurse or a health practitioner will either be permanently in a school or they'll come to school on a periodic phase. So I don't know if any of you remember, I remember when we were in grade 3 or grade 4, we had a group of nurses that came to our school and they did deworming, and there was another injection that they gave us, but it was something that we had to get every 3 years or every 3 months, but I know deworming is every 3 months. But there was a specific injection that they gave us, and it was like a massive drive where everyone was getting these injections. So that's what mostly school nurses will do, is that they'll make appointments with the different schools in the district that they are placed in, whereas sometimes they might need to do talks on how to take care of the teeth, what foods are good for us to eat, physical activity. They might even be involved on like school days, because obviously on school days there's a lot of accidents that happen. They might be involved in that. In much more heavily or well-funded schools, you will have a school nurse that stays on the premise, so that any emergency that occurs on the school premises, they will go to the school nurse. The go to the school nurse type of thing, it's not very famous in South Africa. I've seen it a lot on American TV shows where, go to the school nurse and things like that, and it'll be good in South Africa, but obviously it's a lot of money because you have to pay someone on a payroll to stay at one school compared to paying one nurse who's going to different schools. But pretty much these school nurses, their job is to ensure that they're going to these schools, to making sure that every child is meeting their milestones. If you have any students that have any chronic conditions, type 1 diabetes, epilepsy, ADHD, they get involved in the managing of these students, and also if there's any medication involved, they would be heavily involved in this type of schools, and they'd also be doing drives. For example, if there's a lice breakout in the school, they would get involved in trying to deal with that. Yes, I know a lot of schools right now, they're dealing it on their own and the teachers have to deal with these things, but that's pretty much what school nurses do. So these are the different types of roles that you can take up if you want to be someone who wants to be involved in child nursing. And depending on how deep you want to get into, you can either do it in a hospital setup or be a school nurse. So a school nurse is mostly like a community-based type of nurse. So obviously your working hours are a lot less, but you have a lot more admin than the other nurses are, because obviously you're now dealing with a lot more children than someone who is working in a hospital setup. So I absolutely love working in pediatrics, and I've had a good chunk of experience in there. So I'm just going to be running down through a few different skills that you need to be working in these different specialities. So I'll just start first off with just the pediatric ward, which is pretty much babies that are sick, and babies get sick a lot. That is something that we have to be aware of. And obviously in a pediatric ward, you're now dealing with the child, but you're also now dealing with the parent, because obviously the parent and the child, they get admitted together. It's a package deal. So in these type of situations, you need to know how to manage the very stressed parent who has brought a child into the hospital. That's the last place that they want to be in. So obviously they are stressed, they are anxious, and obviously different parents parent their children differently, and there's different things that they want done a certain way. So you have to deal with those type of personalities. The mom wants the bottle to be fed this way and things like that. But obviously the great thing about having the parent involved is obviously they do majority of the work, the feeding, the changing of the nappies. They assist you with giving medication, as long as you're guiding and you're educating the mom on what exactly you're doing, why you're giving it, what is the indication. You have a great relationship with the parents. They just want to know, what the hell are you giving their child and what is it for? Is it necessary? And things like that. And obviously in this type of environments, you're going to be dealing with moms that do not want to vaccinate their children. So it's going to be a lot of those conversations of, okay, we're not vaccinating, why not having those conversations and working around that. And you just have to deal that when you're working in pediatrics, you're going to get sick a lot. Kids, they pick up a lot of things, and most of the kids that actually end up getting admitted in pediatric wards is kids that have started going to crash, or the kids are interacting with a lot of other children, and because they're interacting with each other, they are sharing all these illnesses, and as a result, they end up getting sick. So everything is small, minute, and it is so adorable working in a pediatric unit. But the one thing that I have to warn people that want to get into this discipline is that babies are not miniature humans. They're a whole different specimen, if I can put it that way. Yes, everything is much smaller. The quantity of the medication, the needles, the BP cuffs, everything is smaller. But babies, they just function differently. Their vital sign normal range is much different than adults. The way that they react to medication, much different to adults. The way that they bounce back after they've been sick, much different to adults. So you have to treat pediatrics as a whole different faculty, and they're not miniature adults. You literally cannot downscale what you do with adults back onto babies. You just have to learn a whole different language, and you just have to be a lot more patient, because obviously you're dealing with someone's child. But the amazing thing about working in pediatric units is you get to learn a lot. The doctors are very on fire, they're very finicky, they're very particular about how they want things done, because obviously babies are very sensitive. Small changes can really affect their conditions. So when you're working in pediatrics, you really have to pay attention to detail. You have to make sure that your medication calculations have to be on point, because it's a lot of calculations that you have to do. Medications comes in syrups or in syringes, and you have to give the smallest amount of units, and you have to be on the ball of that. But yeah, pediatrics is amazing. You get a lot of gastro issues and respiratory issues. That's what most babies get affected with. The respiratory, everything, just any virus they catch on and they get sick. And obviously their tummies, most of them are very sensitive to different foods that they're eating and things like that. And obviously in this department you also have to be doing a lot of education. Yes, parents will come with their own ideologies and how they want to parent their kids, but you also have parents that are also very welcoming and they want to know. They don't know how these things are done, especially like I said in my video last week, new moms or first time parents. They are the most amazing people. They are very curious, they're very inquisitive, they are so confused and they don't know what's happening and they need a lot of education, and they are the best to really coach. So this is the time when you're coaching them about breastfeeding, when you need to be changing nappies, how often you're supposed to be washing them, which medications are safe. Some moms want to breastfeed and also do formula, and you have to speak about the pros and cons of doing that and sort of thing. So obviously it's now again about education, but it's such a fun department to work in. Then now comes your ICU departments, whether that's your neonatal ICU or your pediatric ICU. But obviously in a neonatal ICU, it's more high stress, because you're having preterm babies and you're having babies that are really sick. So it's really a touch and go. You really have to be on the go. With all ICUs, everything has to be monitored meticulously, the way you're giving your medications. As a result, these ICUs involve a lot of pumps and syringe drops, because everything has to be calculated. How much exactly are you giving this child? Everything is to the detail, and you have to record everything. Everything is very specific, and it is understandable. This is kids that are extremely sick, and as a result, babies in general are very sensitive to different changes, whether that's temperature, whether that's an infection, whether that's difficulty breathing, etc. Meaning that you have to be on the eye on everything that you're doing. But it is an amazing field to learn how to take care of these babies that are sick. You get to learn a lot about different machines that you're using, how to use high flows, how to change the different oxygen settings, how to attach your baby to the monitor and things like that. It's honestly, pediatrics in whole or school nursing as a whole, it's honestly just about paying attention to what is happening to the child. Because like I said, babies, their conditions change drastically, and you need to be watching these minute changes as they're happening so that you can do an intervention as quickly as possible, because you don't want to delay, and then by the time you intervene, sometimes it's too late, or it takes much longer time for them to get back to where they were. So paying attention to detail, be willing to learn, and also doing research. You're gonna need to do a lot of research and understanding how pediatric nursing works, because like I said, they are not smaller humans. They are whole different species on their own, and you have to learn how to manage them. So obviously, how do you become a school nurse or a child nurse? So obviously, if you graduate either from your diploma or your bachelor, you can automatically work in a pediatric unit because it's part of your training. Then you can go into it slowly from your pediatric ICU, but it should be advisable to do a postgraduate diploma in critical care nursing, because you get to learn a lot more. And I was also doing some research as I was working in pediatric ICU of some courses that are available if you don't want to go back and do a full degree. And UCT actually has 6-week courses that they host throughout the year. They're like 7K, but it also gives you some background of child nursing, the different illnesses that affect children, how to manage those conditions, especially when it comes to fluid management, especially when it comes to prescribing medication, how long a medication is actually supposed to be given to children. Did you know that children can only use nose inhalers or those nose sprays for a maximum of 5 days? Nothing more. That was something that you learn. So yeah, it's very important that especially in pediatric ICU and pediatrics in general, you're constantly updating yourself on how to take care of these babies. What are the new ways? What are the different normal ranges and things like that? So if pediatric nursing would be something that you'd be interested in getting into, definitely comment down below and let me know, why do you love kids? I know some people are like, ew, babies, too much work, can't deal with them, I'd rather deal with adults. You can speak to them, they can tell you what's wrong with them. Whereas babies, they really can't. But yeah, let me know down in the comment section why you want to work in a pediatric unit. So you can check out the video that I did last week about maternity nursing, or you can click over here and check out my experience that I had working in a pediatric setup during my clinical placement. Until next week, Friday, 12 p.m. South African time, have an awesome one.